Hi, Belén. Good afternoon.
Hi, Miss. Good afternoon.
Okay, now you can hear me, right? Not like yesterday.
Right.
Okay, that's good. Let's wait just 2 minutes, please, for your classmates, and then we're going to start.
Okay.
Did you have the chance to send your answer to Alison?
No. I will do it right now.
Okay, please. Okay. Hi, Lily. Good afternoon.
Hi, teacher. Good afternoon.
Lily, did you have the chance to send to Alison your answers?
Yes, teacher. I sent it yesterday.
Okay, thank you very much. Let's start then. Okay. As you can see, this time we're gonna see screening and immunization. Do you understand the word screening in this case? Do you have any idea of what it means, more or less? Okay, in this case, screening is is a way of identifying at increased or greater risk for a condition. Although they do not yet have any signs or symptoms, in some cases, mass screening means screening large numbers of people. It means that it can be used as examination, okay? It's almost a synonym. Is appropriate, is there? Okay, Ale, welcome.
Hi, teacher.
Hi, good afternoon.
Good
Okay.
afternoon.
Is appropriate, for example, in the past for tuberculosis, in other cases, only those with high risk factors, like a family history of conditions such as cancer or diabetes, are screened. That will be almost a synonym of an examination, okay? However, these are a number of problems with screening. There are always false negatives, cases where a patient has a disease, but screening does not identify it. There are also positives where someone is told they have a disease when in fact they do not. Furthermore, with some diseases, early identification is of no benefit to the patient as there is no treatment available. I don't know if you have any questions still here of vocabulary or maybe in context.
It's fine, Miss.
It's okay? What about Ale and Lily?
Yes, teacher, I understand.
Perfect.
It's okay, Miss.
Okay, very good. Well, we have the common screening tests. Can you read, please, Lily, the first one, then the second, Ale, the third, Belen?
A common screen test. Conditions, neural tube defects, and Down's syndrome risk. Tests, AFP, subjects, pregnant woman, frequency between, no me deja ver acá.
16
Yeah.
and 17.
16 and 70 weeks.
Condition, breast cancer, test, mammography, subjects, women 50 to 70, frequency every 3 years.
Condition, cervical cancer, test, smear test, subject, a woman, 20 and 60, frequency, every 3 years.
Okay, thank you very much. So we have here the conditions, the tests that must be done, and in which kind of subjects, and in which frequency, okay? Here, this means that a breast cancer test, like mammography, it must have been done in women between 50 and 70 years old, okay? Every 3 years. Here we have AFP, that it means alpha fetoprotein in blood, okay? And it's been done in pregnant women between 60 and 70 weeks. Okay, we have another condition here, cardiovascular disease. The test will be blood cholesterol, and the subjects will be more than 40 years old with high risk factors. And the frequency will be every year. Okay, Belen, can you read the other part? And then Lily?
Secondary prevention, cholesterol, I don't know how to say that.
Major 4.
Okay, major
You
4. Test blood cholesterol, subjects, patient with heart disease, frequency every 6 months.
Okay.
Diabetic retinopathy. Test, ophthalmoscopy, subjects, patients with diabetes, frequency every year.
Okay, so we have, I think this is, these tests or those tests are are most common in every single part of the world. But I don't know if you have something to add or you are not agree with these ones, or which one do you usually use in consultation, or which ones are the most common? Are you agree with those?
Yes, Miss.
Okay. What about you,
I
Lynn?
think in the pregnant woman, in my country, I use the ecography, the first trimester between the 11th to 13th weeks for detect defects such as Down syndrome risks.
Okay, so this one that we were mentioning, alpha fetoprotein in blood, is being used here between 16 and 17 weeks. And in your country, ecography is being used between 11 or 13, just to know if the product has Down syndrome risk.
Yes, teacher.
Okay, that's interesting. I don't know if Ale or Belen knows that here we have the same tests.
Yes, we have the same tests, Miss.
Okay, so we can add that one here, right? Because this is from UK. That's so good. Thank you, guys. Then we have immunization for travelers. The following vaccinations are recommended for travelers to South Asia. It's easy to read for you guys, or it's so little the letters?
It's fine.
Okay, then can you help me? The first one will read Belen, the second one Ale, the third Lily, and then we'll continue.
Okay. Hepatitis or immunoglobulin, e.g. Transmission of hepatitis A virus can occur through direct person-to-person contact, through exposure to contaminated water, ice, or shellfish, harvested in contaminated water, or from uncooked fruits, vegetables, or other food.
Okay, thank you, Varen. We're gonna wait here and try to find out if you have any doubts about this paragraph. For example, shellfish harvested. I don't know if you like to eat fish and the other kind of things like that. I really don't like fish, but I don't know you guys.
I love fish.
Okay, you like shellfish?
Shellfish harvested is like when you, well, harvest is like the thing that do the farmers, right?
Right. But in this case, in water. And
So it's people that caught their fishes and they eat then the fishes
yeah, that's right.
without
I know.
having the process, I think.
Without having what? I'm sorry.
The process that they used to do the supermarkets and that thing.
Yeah, Yeah, that's pretty much like that. A shellfish harvested. I don't know if Lily and Ale has any doubt about these words. Do you understand the explanation of Belen?
Yes, teacher. I understood the explanations of Berlin.
Okay. Ale, what about you?
No, miss, I didn't understand.
Okay. We have in Spain this dish with shellfish. I don't know, Belen or Lily. Paella, right?
Mm,
It's made of shellfish, Ale, and means that people will get this shellfish from the sea, and then we'll eat. Do you understand now?
it would be like, I don't know, camarones.
Yeah, it's more or less like that. Eh, Mariscos, okay? And harvested is cosechado in this case, but in contaminated water, okay?
Okay, miss, thanks.
No problem. Okay, then I think you don't have any other doubts, right, here? Can we continue with the other paragraph? Hepatitis B.
Yes, miss.
Okay, Ale, continue, please.
Of course. Hepatitis B, especially if you might be exposed to blood or body fluids. For example, healthcare workers have sexual contact with the local population or be exposed to through medical treatment.
Okay, thank you. Here have you any doubts about this paragraph?
No, miss.
Okay,
It's fine, miss.
Now, teacher.
perfect. Lily, your turn. Japanese encephalitis.
Japanese encephalitis. If you plan to visit rural farming areas and under special circumstances, such as no outbreak of Japanese encephalitis.
Okay. Do you understand the word outbreak? Is, for example, now we don't have so much patients for COVID-19, right? But it could be another outbreak in a month, maybe, where a lot of people can be infected again. We have the first outbreak in March of 2020 of COVID-19 here in Bolivia, for example. The second one was in, I don't know, November, maybe. And some people tells us that the third outbreak of COVID will be in a month. Now, do you understand the word?
Yes,
Yes.
teacher.
Yes,
Yes,
Miss.
Miss.
Can you say it in Spanish, please?
Rebrote.
Yeah, Vania, hi, welcome. Okay, outbreak is brote, okay? A new outbreak will be like a rebrote, okay? But that's good. Then, Vania, can you read malaria, please?
Malaria. Your risk of malaria may be high in these countries, including cities. Travelers should take an effective anti-malaria drug.
Okay, thank you. Do you have any question here?
No, Miss.
I don't know. I didn't know that there were an antimalarial drug. Maybe we have the vaccine, or am I wrong?
In the pandemic of COVID, they used to, in one point, they were receiving hydrochlorothiazida. That's the anti-malarial drug.
Oh, I didn't know that. That's interesting. Okay, thank you, Belen. Then we have rabies. If you might have extensive unprotected outdoor exposure in rural areas. And we have typhoid. Ale, can you read this part, please?
Yes, Miss. Typhoid. Typhoid fever can be contracted through contaminated drinking water or food. Large outbreaks are most often related to fecal contamination of water supplies or food sold by sweet vendors. Vaccination is particularly important because of the presence of East Tiffy strains resistant to multiple antibiotics in this region.
Okay, thank you. This STV means streptococcus, right? The one who caused the typhoid fever. And it's antibiotics, okay? I don't know if you have any question here.
Mrs. Salmonella typhi.
Oh, okay. Thank you. Any other question or add? Okay, it's perfectly understood then.
Yes, Miss.
Okay, what about Lily?
Yes, teacher.
Okay. Then we'll go to epidemiology. And we're gonna talk about rates. Do you understand the word rates?
No, teacher. I don't know this word.
Okay, any one of you guys? Okay, it means tasas, okay, in epidemiology. The study of the spread and control of diseases in the community, it is epidemiology, requires analysis of frequency. That will be the number of times something occurs in a particular period. We talk about frequency using word combination with rate, okay? Then we will have birth rate, the number of births in a population, that will be a group of people. Death and mortality rate, the number of deaths in the population. Then we have case fatality, and the rate will be the number of deaths from a particular disease. And the last, survival, the rate will be the number of patients still alive after a treatment for a particular disease. Okay, and we have some examples. The birth rate in Singapore is 10.2 per 1,000 population. The infant mortality rate in Singapore is 3.0 per 1,000 live births. Okay, other words used to talk about frequency. We have an example. Malaria is common in many developing countries. Or we can say malaria is uncommon or rare in developed countries. Do you have any questions of vocabulary here? Anybody?
No, teacher.
Perfect. Ale or Belen, Vania?
No, miss.
Miss.
Perfect.
No, miss.
Then we have incidence and prevalence. The prevalence of a disease is the number of people in a population who have the disease at a particular time. On the other hand, the incidence of the disease is the number of new cases of the disease during a particular time. Okay, we have an example. Incidence of malaria is high in many developing countries. Or we can say the incidence of malaria is low in developed countries. The incidence of HIV infection is highest in Sub-Saharan Africa. Or we can say the incidence of HIV infection is lowest in the Caribbean. We have a note too. You don't say the incidence of malaria is common, or the incidences of a disease in different groups are often compared. Okay, and we have an examples. Rheumatoid arthritis is more common in females than in males. Okay, or rheumatoid arthritis is less common in males than in females. Or we can say men and women are equally affected by restless leg syndrome. Do you understand this definition, restless leg syndrome? Did you hear about that? Hello?
No, miss.
Any clue? No? Okay.
No.
For example, you can see a patient who is anxious, okay? And you will see his leg always tapping the floor, okay? Because he's anxious or nervous. That is the restless leg syndrome. Or in Spanish, we can say síndrome de piernas inquietas. I don't know if you heard about it sometime.
Yes, Miss. Now, yes.
Okay, and that was the definition, or you have another way to say it?
No, it's just like that.
Okay, Belén, thank you very much. I don't know if you have any other question of vocabularies or definitions.
No, miss.
No, teacher.
No, miss.
Perfect. Let's continue then. Association and causation. We have 3 paragraphs. The first one, can you help me, Vania, please? The second, Belén, and the third, Ale.
Okay. Association and causation. Studying the incidence of disease in particular groups of people can lead to the discovery of causation. What makes it occur? For example, the high incidence of lung cancer among cigarette smokers suggests that smoking is a causative factor in the development of lung cancer.
However, care must be taken not to assume every association between a disease and a measured variable is causative. To say there is an association between two things simply means that they occur together in a certain situation. For example, several studies have indicated high rates of lung cancer in cooks.
Although this could be a consequence of their work, perhaps caused by carcinogens in fumes from frying. It may be simple because professional cooks smoke more than the average. In other words, smoking might confound the association with cooking.
Okay, thank you very much. I don't know if you have any questions here of vocabulary. And if you are agree with these paragraphs, do you understand the word causation? Anyone?
It's the cause? I don't know what you understand like that.
It's more like a casualty. We have the association. For example, the cigarettes may cause cancer, right? It's an association. And a causation will be on the other part of the paragraphs that told us that some cooks get cancer just because they are cooked or because they are cooking, maybe caused by a carcinogens in fumes from frying. But it's a causation because it's not, this is not the reason. The reason is smoking might confound the association with cooking, because these people says that cooks are the ones that smoke a lot, okay? So that's how they get cancer, and not by cooking. That's a causation. Do you understand the differences? Uh-oh. Girls?
Yes, teacher.
Okay. Lily. Thank you. I don't know if you have another example that can help us understand better.
Unhealthy diet, causation, obesity, maybe.
Yeah, can be that. Instead of says that cigarettes or because they smoke a lot, they get cancer, we can say that they eat a lot of carcinogen things, right, on his diet, and that's why they get cancer, and not by the carcinogens in fumes from frying, right? Can be another causation. Do you understand now better?
Yes, Miss.
Yes, miss.
Okay,
Yes,
what
miss.
about, perfect. Okay, thank you. And I don't know if you have any word, any doubt about words. Can we continue then?
Yes, Miss.
Yes, teacher.
Okay. We have this part, this second part, that is medical ethics. Okay. GMC guidelines. Okay, we have here some guidelines that will help us. For example, care means protecting and looking after someone. The duties of a doctor registered with the General Medical Council include, and that's the meaning of this abbreviation, okay? General Medical Council. 1, make the care of your patient your first concern. Then we have a professional competence. That means a level or of specialized knowledge and skills that we are gonna find here. Recognize the limits of your professional competence. Then we have confidential, that means private or secret. And here on the number 7, we have respect and protect confidential information. We have also risk, that means possibility of something bad happening. Okay, in number 9, we have act quickly to protect patients from risk. If you have good reasons to believe that you or your colleague may not be fit to practice. And we have that fit to practice means in a suitable condition to work. Okay, we're gonna read the other ones. Number 2, treat every patient politely and considerately. 3, give patients information in a way they can understand. 4, keep your professional knowledge and skills up to date. Okay, I think we read everything. And the note, for a full list of the guideliners, you can go to this page. Okay, and I don't know if you want to add some other guideline to this list. Something that you usually work with daily. And of course, if you have any doubts of vocabulary, we will found an explanation. But I really want to tell me if you have any other guidelines that you usually work with.
Teacher, what means fit to practice?
Okay, what it means fit to practice. In a suitable condition to work. Maybe sometime you cannot work or you don't understand the area, okay, your patient needs. You won't tell him or her what to do if you don't know, right? So you have to be conscious and said, no, I have to tell my colleague to tell her about the specific area he is specialized in. Okay?
Okay, teacher.
Maybe I'm a dentist, for example. And of course, I know things in general, but I'm not a doctor with a specialization, right? So I'm not allowed to tell my patient what to do or what to take, maybe some prescription. It will be worst for him or her. So I have to tell her or him to go to the doctor, right? That is an example.
Thanks, teacher.
No problem. Come on, I know you have any other guidelines. I'm so curious about that. For example, I don't know. I want my patient to feel comfortable with me. So I start to talk about her and ask some other questions just to get in touch, to be confident. And then, of course, she will be more calm, right? Especially at my consultory, right? Because everybody are scared of the dentists. Nobody? Any other question?
No, miss.
Miss.
No, miss.
Okay. You don't want to add anything else here in this list?
No, teacher.
Okay. Let's continue then. We have the bioethical issues, okay? And we're going to talk about euthanasia. Should the medical profession help the terminally ill to end their lives when they choose? Genetic engineering, should we permit an embryo to be cloned? That means copied exactly, or to replace a child who has died? Should parents be able to select the genetic makeup for their children to produce so-called designer babies? Well, we have three questions here, three interesting questions, right? And human fertility. IVF means in vitro fertilization and has made it possible for an unfertile woman to have children but should this include women long past the normal age of childbirthing? Embryos can be frozen and implanted in the mother at a later date, but should be require the consent or permission of both parents if the marriage has broken down? What are the rights of a surrogate mother on who carries a child for a woman who is unable to do so over that child? Okay, we have here a lot of questions, a lot of interesting questions, right? I don't know, what is your opinion? Do you agree with this? Or maybe you have any reason for what not to do these kind of things?
I agree about euthanasia, but not from genetic engineering. I think that's not good. And I also agree with the IVF.
Okay, Belen, thank you. What about the other guys? Vania, Ale.
I agree with IVF. I don't agree with euthanasia.
Okay.
I think there are um, many points very important. For example, when the woman don't have pregnant, these persons can't have a child, but I disagree with genetic engineering. Mm, mm,
Okay, Lily, thank you. And Ali, what about you?
I'm agree with all, Miss.
Okay, that's interesting. Okay, and since we don't have so much time here to talk, we're gonna talk tomorrow about this, okay? I'm writing down about a specific topic of these kind of things, and we're gonna talk about this tomorrow. But if you have any question for vocabulary, you can say it now.
What is surrogate?
Where is it, please?
In the final paragraph, in the almost the final sentence.
What are the rights of surrogate mother? One who carries a, okay. A surrogate mother is one who carries a child for a woman who is unable to do so. A substitute mother, right?
Right, thank you.
No problem. Another question?
No, Miss.
Okay, Vania, Lily.
No, Miss.
no, teacher.
Perfect. I cannot see it. Okay. Then we have assisted dying a medical student has made. Can you read this, please, Vania, the first paragraph and the second, Lily?
A 53 years old woman with incurable muscular dystrophy flew to Switzerland to end her life. Assisted dying is legal in Switzerland, but illegal in the UK. Opponents of euthanasia or mercy killing argue, argue, argue that legalization would lead to abuse and call for doctors who participate to be struck off. What Britain needs, they claim, is better palliative care and more hospice for the terminally ill to allow such patients to die with dignity.
This follows a recent U.S. case where the husband of a woman who had been in a persistent vegetative state for 16 years was successful in having artificial feeding withdrawn in spite of opposition from these white parents.
Okay, thank you. And then we have the words on the right side, struck off, removed from the DMC. Oh my God, I cannot read. Anyone can read this? Register and, oh, I cannot read it. Okay, but do you have any questions here?
About the stroke of, I don't
Okay.
understand.
I'm trying to find a way to read this. I don't know. Okay, removed from GMC register from practicing medicine in the UK. Here we have ARG, okay, is to have a conflict or a discussion, a problem with someone, okay? ARG, that legalization would lead to abuse and call for doctors who participate to be struck off, to take off the list of the medicine, of the practitioner's medicine. That is struck off. Do you understand? To be eliminated. That could be a synonym of struck off. And in Spanish, it might be like tachado, tachado.
Okay, Miss.
Do you have any other questions? Perhaps we cannot read this side because it's so blurry. You have on your books, okay, this part where you can find the definitions. But here we can solve any doubt. Any other questions?
No, miss.
Okay.
No,
Ale,
teacher.
No, miss.
perfect, Lily. Thank you. Okay, Vania, do you have any question?
No, miss.
Excellent. And research studies. Case control studies. Here are some extracts from a medical textbook. In a case control study, a group of suffering from a disease cases is compared with a group who do not have the disease, but are similar in other ways, the controls. The two groups, the participants in the study, are compared to see if they were exposed to a possible risk factor or not. A risk factor is something which may contribute to the cause of a disease. This type of study is often used as a first step in identifying the cause of a disease. Okay, do you have any questions here?
No, miss.
What about Vania, Lily,
No,
and
teacher.
No, miss.
Ale?
No, miss.
Okay, thank you, guys. And we're going to talk about the cohort studies. Okay. In a cohort study, a group or cohort of people, subjects, who are similar is studied over a period of years, a longitudinal study, to determine if there is a relationship between exposure to a risk factor and development of a disease. At the beginning of a prospective study, none of the subjects has the disease. I'm sorry. They are followed up for a number of years, and at the end of the period, those who have developed the disease are compared with those who have not. In a retrospective study, the researchers look back by studying hospital records, for example, at what has happened in the past, comparing subjects who have developed the disease with those who have not. In a cohort study and in a case control study, the subjects are only observed and there is no intervention, such as drug, treatment, or surgery. A cohort study is a more reliable method of identifying the cause of disease than a case control study. But for proof of cause, a trial is needed. Do you have any questions of vocabulary? Any questions for vocabulary, ladies?
No, miss.
No, teacher.
Perfect.
Mm,
We're gonna see how much. Okay, we have two more, but we have to do it next class. Okay, just to know. I will share my questionnaire with you, please. Can you fill it for me? And I want you to tell me who's gonna be first and second, third and fourth. Thank you.
I'll be the second, Miss.
Okay.
I could be the
Who's
first.
gonna be the first one?
Ay,
Uh-oh. Ale or Vania? Lily. Sorry.
I
Okay.
I want the first.
Okay. Lily, Ale, then
the third.
okay, Vania. And Belen, you're gonna be the fourth. Okay? Okay, thank you very much, guys. Have a nice night. It's raining a lot here. Thank you very much and take care. See you tomorrow then.
Thanks, Miss.
Thanks, teacher. Bye-bye.
Thank you. Bye-bye.
Bye, girls.